Welcome to Your Health is Your Wealth. My name is Argo Duenas, and I'm your host for today. I'm also the owner of Back to Nature Health and Wellness Center, a local holistic wellness center that has served the Baltimore, D.C., Virginia area and Eastern Shore area for over 30 years. I am so happy today. This is our health segment today, and I have as my very special guest Dr. Erin Kinney. Dr. Kinney, oh my God, she's awesome and amazing. She is on a mission to help stressed out women improve our mood, right?
Oh yeah.
Balance our hormones and increase our energy. She is passionately, incredibly passionate about helping women to understand why stress causes so many health problems and to also teach us, right?
Yeah.
How to manage our stress, reduce our stress, and even change our response to stress so that we can take better care of ourselves, take back our bodies and our lives.
Yeah.
Thank you for taking time out from your busy schedule today, Dr. Kinney, to be here.
Thank you for having me. I'm delighted.
You're quite welcome. I always ask my guests, because this is an upfront and personal interview, to please share with us something about yourself, your family, where you're from.
Sure. Well, so I grew up here in Annapolis, so I'm an Annapolitan.
Oh my goodness.
Yeah.
I am too.
Yeah.
honestly, I didn't know that.
Oh, that's right. Yeah, we never talked about that. Yeah.
Wonderful.
So, and I have two younger sisters, and my family was always very alternative health minded. You know, if we had a headache or something was wrong, we weren't given Advil. If we had a fever, you know, I was told to drink water or the fever's fighting it out. So I kind of grew up with an amazing mother who knew a lot about how the body worked, and then my journey into naturopathic medicine was one of my own. I went through a lot of health struggles and ended up going to see a naturopath doctor who really helped me and helped me get back to, you know, the person that I was supposed to be. So I then kind of had this thought in my head, wow, I would really like to do this. I'd like to help women experience the same type of healing that I went through.
Yeah, you know, I think we have similar paths because
Yes.
that's how I got into natural therapies as well.
Yes.
Because of health reasons. I embarked on a journey to heal myself.
Yes.
And as a result, the universe always orchestrates,
Definitely does.
right? The right people, the right experiences to help you on your path.
Yes.
So that was sort of a defining moment for you.
It definitely was.
At what was your age when you went?
Well, so I can give some more details. I was just out of college, and I had been a huge athlete in college. I'd been a marathon runner, and I'd also become a vegan around the same time. And for the first little while, I felt great. And then my health slowly started to kind of decline. So the year after college, I gained 35 pounds, my joints started hurting, I couldn't get out of bed, and I was severely depressed. I was crying all the time. I cried for 2 hours in the morning, I would pull it together, I'd go to work, and then I'd come home, and I kept thinking, because I knew so much about, or I thought I knew so much about health, I kept thinking, I eat this perfect vegan diet, what is going wrong with me? And so I went to my primary care physician, and he just wanted to write me a prescription for Wellbutrin. And that was not, I didn't accept that. I knew there was something, you know, physiologically wrong. I knew it wasn't just depression. So I ended up then going to a therapist, and she was the one who referred me to a naturopathic doctor. And I had basically put my body through a lot of physical stress with all the running, and I didn't give my body enough nutrients. So I'd put myself into something called adrenal fatigue, which is now what I specialize in treating. And it can cause depression, it can cause weight gain, it can cause joint pain, it can cause all kinds of things. And he was able to put me back on a dietary plan, a supplement plan, and within 6 weeks, I was almost 80% better. So it was really life-changing.
Right.
I thought, wow, I went from this place where I was so low and not feeling good, and now here I am feeling so much better.
Wow.
And it was really empowering, too, because I was, you know, I was actually making myself better. I wasn't just taking a pill. You know what I mean?
That's a powerful testimony. Like I said, my path's somewhat similar. I was a vegan for many years. Then I joined the military in 1978, went to Germany, and my job was very physical.
Yeah.
You know, we were electronic technicians. We were out in the boonies. We had to, you know, lift. We had to endure.
Yeah.
You know.
Yeah.
So It's interesting how universe puts people together to sort of
definitely.
validate and confirm the work
Yes.
that we're doing.
Yes.
What is the difference between a naturopathic doctor and a conventional doctor?
So mostly the difference is in the training. So, and I say that, let me back up. It's not really the training, it's the philosophy in which and how we look at the body. So I was trained to look at someone who has a whole host of symptoms, to not just try to treat the symptoms, to try to figure out what or why is the body having these symptoms. So I always use this example. If you get the flu, you know, you've got this flu virus entering your body's going to get a fever because it wants to cook the flu virus out. You might throw up because you want to eject the virus. You might have things come out the other end because your body wants to get rid of it. So all of those symptoms, you could suppress them. You know, if you have diarrhea, you could take Imodium, but your body's trying to get rid of that. So you almost want to keep the symptom going. Does that make sense? So
Yeah,
I was trained to look at symptoms as a clue to what is the underlying cause. Whereas I think the philosophy with a conventional doc is, oh, here's the symptom, here's the protocol of medication that we put on to suppress the symptom. So it's very a philosophical difference in looking at the body. And now there are times when someone comes to me and they have extreme joint pain, and I will just use an herb or whatever to palliate the pain while we figure out what the underlying cause is. Does that answer the question?
Of course. As a naturopathic doctor in the state of Maryland now,
Yes.
are you licensed to prescribe medication?
In the state of Maryland, I'm licensed to practice as I'm not allowed to use the term physician. I'm licensed to practice as a doctor, so I can diagnose and I can treat.
Okay.
I'm not able to prescribe medication. It's different in different states.
Right.
I would be able to prescribe different medications. Naturopathic doctors are all trained as primary care physicians,
Right.
so in certain states we can act as though. The biggest thing that I always explain to my patients when they're on the fence of whether they should see someone like myself or a different integrative doc is that naturopathic doctors receive really intense training in drug, herb, nutrient interaction. So if you're on medications and you're considering taking turmeric or a fish oil or a multivitamin and you want to know, does this interact? Most conventional docs don't have that training.
Absolutely.
They might have done some research or study on their own, but they weren't trained in that. So
Absolutely.
we're very heavily trained. We spend multiple hours, multiple classes learning, okay, if you take this herb, you know, you cannot take these other medications.
Right.
Or if you're on this medication, you can't take these 4 things. So if you're someone who's taking a few medications and you want to do some other alternative things, it's really good to go talk to a naturopathic doctor so you can make sure that you're not doing something that's, you know, potentially rendering your medication ineffective or making it harmful.
Absolutely. I think that's an education within itself.
Yes.
Because I find not only are the naturopaths underused, but also the pharmacists. You
Yes.
know,
Oh,
in the
definitely.
past, you
Yes.
know, before I got into natural therapies, my mom actually would always go to her pharmacist.
Oh, to ask.
To ask about
Yeah.
the side effects, you know, or the contraindications
Yeah, and
of
they're
mixing things.
very well trained in that as well.
And we found that the primary care doctors, like you said, are not well versed
Yes.
in that field.
Yeah,
So-
and not that that's their
No,
fault.
no.
They just don't have the training.
Absolutely.
Yeah.
And then back to the philosophy of naturopathy.
Yeah.
Oh, my goodness. You know, I worked with Andrea Sullivan, doctor, who's a very
Yes.
prominent
Oh, she's
naturopathic
great.
doctor in
Yeah.
D.C. She went to Bastier's College. And of course, we know that it's really all about the mind-body
Yes.
connection.
Oh,
Do you want to
definitely.
speak on that a little bit?
Yeah, so I started getting really into the work that I do now is a lot with women and stress. I find that stress is such a big component. And so when I originally was treated for adrenal fatigue, I was given herbs and nutrients and, you know, and it really worked for me. I then, after my first daughter was born, I went back to running a lot, and I was, you know, running a practice and running a lot and I was burning the candle from both ends. And I started to slip back into that adrenal fatigue sort of space. And so I went back on the protocol of the herbs and the supplements. Well, they didn't work as well. And so I started to think, why aren't these working? I know I'm a little older and I'll have a baby, but I started to dig more into the research, and you know, it was the lifestyle thing. It was the stress that was, you know, when I was in my 20s, I didn't really have very much stress. It was purely a physical stress. I didn't have a kid. I didn't have a business. I didn't have, you know, a mortgage to pay or those things. So I started to do more research specifically how physiologically does stress actually impact your hormones? How does it actually impact your digestion? And it makes such a difference. When you're in fight-flight mode, when you go into stress, all of your blood flow goes to your extremities. So all of the blood flow leaves your internal organs. So your body's not focused on digestion. It's not focused on making hormones, your sex hormones. So some of the first things that I see go wrong in women when they're stressed is their periods start to change. They start to get bad PMS. They skip a period. Their periods get really heavy. There's a whole host of different symptoms. It can start to affect mood. And then there's everyone gets affected in different ways. Some people, their joints will start to ache, or other people, they'll gain weight, or some people will lose weight. But it starts to affect the body in a very, very physical way. And so as I continued to research, I started to look at, well, how can we change that? Because, obviously we can't always change our stressors in our lives. If you've got a stressful job, sure, you could leave it, but you might not always be able to walk out on your job, right? So how can we change how your brain interprets whatever said stressor is and not have it become this full-blown fight flight? So our bodies were wired, whether it's a lion chasing us or an email from our boss, that we need to get something done really quickly, the physiological response is the same, which is kind of a bummer, because you don't need all your blood flow in your skeletal limbs when you're responding to an email. You know what I mean?
I totally get what you're saying,
yeah.
Dr. Kinney. So, for our viewers again,
yes.
Let's kind of list some of the symptoms, or how stress affects our body symptoms, because I'm going to share some things with you too, because I'm human too.
Oh yeah,
and
we all
have stress,
yeah.
And definitely stress, can actually, I believe, be linked to cancer.
Oh, it can definitely be linked to cancer.
So you want to kind of enumerate some of the symptoms that when people, because some people said, oh, I'm not really stressed, I'm just working hard, I've got this to do and I got that to do.
Yeah.
But I'm not really stressed.
Yeah,
I have women who say that.
And you might not feel stressed.
They numb it and they just keep moving,
But your body will start to
Absolutely.
tell you. So I think one of the first ones, headaches, are really common. People will say, I've started getting headaches. Or tight muscles in your neck, or tight muscles anywhere. That's typically a sign that there's not enough magnesium. Your body's using all the magnesium to deal with the stress. Digestive issues are such a common stress, whether that's constipation, diarrhea, irritable bowel syndrome, or reflux is a really common stress symptom. If you start getting acid reflux and nothing's really changed in your diet or nothing, typically that can be caused by stress. Stress will actually cause that sphincter that keeps the acid in your stomach to relax, so all the acid can come right back up.
Wow.
Yeah. So there's a lot of digestive issues. And
what about sleep?
Oh yeah, sleep.
And how it affects.
So, and it can affect sleep in a couple different ways. Typically, it can sometimes help you or stop you from falling asleep. So maybe at night you're laying there and your mind is going 1,000,000 miles a minute and you can't fall asleep. That's kind of the first way it affects sleep. The second is you might be waking up at 2 or 3 in the morning every night, wide awake, and not able to fall back asleep. And typically that happens when your body's in a full-blown stress state. It's like your body's waking up at 3, it's ready to go.
Would you say that could be an anxiety?
It could be an anxiety. Sometimes
Yeah.
that can happen. Sometimes I have people that they don't actually feel bad. They're just waking up at 3 a.m. and then they're tired by 2 in the afternoon because they've been up since 3. And that's typically their circadian rhythm is a little bit off, and stress has done that to them. So sleep, headaches. We talked a little bit about mood. Like I said, with women, periods can get really affected, digestive issues, and joint pain. Sometimes this is not, people won't put it together, but a lot of people have aches and pains, and it's all stress related.
And they don't connect the dots and link it to stress.
Yeah, they don't connect the dots.
Wow. What about high blood pressure and some of the
definitely. So when you think about when you go into stress mode, the heart rate's going to increase, the blood pressure is going to increase, your breathing rate is going to increase, your pupils will dilate. So it's natural for the blood pressure to go up when you're in that.
Well, I tell you what, Dr. Kinney, when I go to a doctor's office,
just your blood pressure go up?
Yes, it does.
Yes. Yeah, because you're
call it
a little
white
nervous.
coat syndrome. Yes, absolutely, yeah. But so now, when we're under stress like this, what are some things that we can do to reduce the stress, manage it?
Yes. So one of the first things, and I love this one, it's simple and it's free, is doing a little bit of breath work. And so I'll have them put one hand on their belly and one hand on their chest and take a deep breath. And you want to focus on breathing into the abdomen. So having your belly expand, which is kind of unnatural for most women because we're always sucking our stomachs in and sticking our chest out, and breathing up here, which is kind of running fight or flight breath. But when you're breathing from your abdomen, it kind of forces your body to get the blood flow back into the internal organs. Does that make sense?
Yes.
So, if you're stuck in traffic, you're late for a meeting, you're whatever it is that's causing your blood pressure or your heart rate to go up, just stop and take 5 deep belly breaths. And that can kind of just calm your system down. You can close your eyes, you can count to 5. Most people who have high stress lives, whether they know it or not, will have small little tools that they use. But I think becoming aware of those tools and using them more consciously can really help. So that's the major tip that I usually have, that anyone can do it. It's free and you can do it anywhere. So that's number one. The second thing is there's so much research right now about gratitude. Just simply being grateful for anything. I'm grateful that I'm here on this TV show today. And when you get stuck in a negative thought loop that's causing your stress, trying to change that thought to come back to one of gratitude will really help shift you out of the stress state and into the calm state.
Yeah, I find that to be very, very helpful. I have a gratitude journal.
Yes.
And, when I wake up in the morning, I just say thank you.
Yeah.
Mm-hmm. When I go to bed, I say thank you.
Yeah.
And when I notice that I have a stressful thought, because we should really become more aware of our thoughts.
Yes.
Thoughts create, right?
Oh,
Whatever
yes.
we think about, we bring about.
Oh,
Whatever
definitely.
we think about or focus on expands.
Yes.
So I've learned this little tip from Esther Hicks. You're
Oh,
probably
I love
familiar
Esther
with
Hicks.
Esther,
Yes.
okay? And that's to pivot.
Yes.
When I find myself in a stressful thought pattern and I'm feeling a little anxious, I will look around and I will see a beautiful tree and I'll pivot my thoughts, and it's, oh, that's so beautiful. Oh, this is so beautiful. I look up at the blue sky, and I said, just thank you, thank you. So that mind-body connection, Dr. Kinney, is so real.
Oh, it's so real.
I have clients, we're going to talk about this, how it affects the GI system, that will come in and their complaint is that they have bloat, gas, constipation, and they can't have a good BM.
Yes.
And many times, if it's very severe, the doctor will send them to get a MRI, CAT scan, or X-ray, and 99% of the time, 99% of the time it's normal, but it's gas that's blocking.
Yes.
Because like you said, when we're in that fight or flight mode, we're never digesting our food. The waste just sits there, it putrefies, and then it produces more gas.
Yep.
So I've had clients who've had psycho-emotional releases as a result of getting a colonic, honestly.
Oh, yeah.
They will start to tear up and then begin to share and release what has been going on in their life, the traumas and the dramas. So there's cellular memory right there in the gut. You want to expand on that a little bit?
There's cellular memory in every cell.
Yes.
When you experience, whether it's an emotional trauma or a physical trauma, if you have surgery or a car accident, you can do therapy and work it out of the mind, but the cells hold on, they remember that. And it's really interesting. There's a colleague of mine, she practices in Richmond, Virginia. She's done some interesting research. Her name's Dr. Leah Holland, on generational traumas. So example, survivors of the Holocaust, where they actually have changes in their cellular DNA that can be traced back to survivors that then procreated. So it's kind of an interesting, it's just proof that trauma can stay in the cells. But the good news is the body is so amazing at healing itself. So I get a lot of patients that will say, oh my gosh, there's trauma in my cells, what do I do? Well, we can fix that. Your body, you just have to let it out, right? So in a colonic, if you're constipated, a colonic's a great way to literally get, can I curse on TV?
Well, no, just
get the
out. Yes, absolutely. And that's, not only physically, but emotionally, mentally, and spiritually. I had a lady, honestly, when I was working at Dr. Sullivan's office 30 years ago, I was giving her a colonic, and she started to regress. And she was just going through the motion of really trying to protect herself.
Yeah.
And I just my, I'm very new at this, but my always been kind of tuned into my spirit. My spirit said, just be present with this lady and allow her to just release.
Yeah.
And then she was a registered nurse. She didn't have any children, but she was in therapy, and she was just sharing with me that her mother traumatized her with trying to harm her physically.
Yeah.
So those cellular memories are really there, and it can be there for years and years and years. And getting some type of energy work like Reiki, colonic, massage, the energy work really helps to release those traumas on a deep emotional level.
And I'd say, for some people, because I have some patients that energy work, they're like, I'm not quite sure if I'm ready for that. Even just being with someone who will hold space for you to
talk.
And I think that's really, because some people go through emotional traumas, physical traumas, and they don't ever share it.
Absolutely.
And the first step is to getting it out, is to actually speak it and let it come out of your body. When you hold any sort of emotion in, it's going to go somewhere. And I think you earlier mentioned, before we jumped into this stress talk, about stress causing cancer. And in my mind, that's how it happens, is we get so stressed out and we keep it in. We keep anger in, we keep guilt in, whatever the emotion is, and you don't get it out, it's going to turn into, it's going to affect those cells, and it can put you more at risk for cancer or any sort of chronic disease.
So when you say by being more consciously aware of our thoughts and our feelings and what's going on in our bodies, we can make those changes.
Oh, we definitely can. Are you familiar with Dr. Emoto, the Japanese?
With the water?
With the water,
yes.
So I explain this a lot to patients when I talk about why gratitude is so powerful at actually changing things physically, because it seems people can understand why, being grateful, that shifts my mind, but how does it actually affect me physically? Well, Dr. Emoto, if you're watching the show, go Google this, because it's pretty interesting.
You spell his name.
It's Emoto. He was a Japanese guy, and he did research on what happens when you look at water at its molecular form after it's been exposed to someone saying positive words versus someone saying negative words. So he would say love to water and would think love and would just emulate love toward water, and he'd take a picture of it, and the crystals would be beautiful. Like I said, you can Google it. Then he would take a different glass of water and say hate, and he would focus lots of negative energy, and the image, it was ugly. There was no symmetry to it. It was not like a beautiful snowflake like you would see when there was a beautiful word. So he's done hundreds of different words and different things, and shows that the actual molecular structure of water changes based on the intention of the energy behind which it. So if I were to sit here and say to you, you look so beautiful, you look amazing, this is wonderful, I'm actually changing the structure of your cells. Versus if I were to say to someone else, I don't want to say it to you, but you're ugly, or I hate you, I'm actually negatively impacting. I think there was a video a couple years ago that went viral about plants, and it was showing plants that were bullied versus plants that had music played for them or spoken nicely, and the bullied plants all died.
Wow, that is such a profound awareness.
Oh, it's huge.
Of how we are energetic beings.
Yes.
And it's all about frequency and vibration.
Yes.
And the higher the emotions of love and gratitude are on a much higher frequency and vibration, it does affect us at the cellular level. We have a few minutes left, and I know that you're very known as the expert, as the stress reset doctor.
Yes.
So the holidays are coming up. Can you give us some holiday tips about how to reduce the stress? And people tend to gain weight during the holidays and sort of eat unconsciously.
Yes.
And then the toxins build up, and then they'll call me and say, Argo,
please get me in.
I can't go to the bathroom. I need to see you ASAP.
Yes.
So here we go again.
Yes. So what I would say is, one of the things that I hear the most around this time of the year is people actually forgetting to eat during the day. Is that they're running around, they're working, they're shopping, and they don't, they eat breakfast, and then maybe they don't eat, and it's 3 o'clock and they're starving, or it's 5 o'clock and they're at a holiday party and they go off their diet because they're so hungry. So my biggest holiday tip is pack snacks. Like, maybe you don't have time to sit down for lunch, but pack low, high protein snacks, nuts, a hard-boiled egg, something simple that you can eat when you're on the go. Because most people, like I said, they don't eat enough during the day, so when they get to whatever party, they're starving, and then they just give in and they eat whatever.
Right.
And so I think that's why most people tend to overeat at parties, is because they've been running around. So that's my biggest tip. And the belly breathing is the second one. You can do that as much as you want, and doing that before you eat actually helps to stimulate digestion, and it helps your body accept and absorb the food, which is really nice.
And give us a little bit of information on detox and why it is definitely important to detox at some point.
Detox is super important, as long as you've been okayed by your doctor to do that. You know, as she was mentioning, when we're eating a lot of foods that we're not usually used to, or we're drinking alcohol, or we're, you know, exposed to whatever stuff, it can build up in your cells. And if we're not helping the body get rid of it, if you're constipated, your body's not getting rid of toxins. And as they build up, they can cause cellular damage. So it's really important to keep things moving through the body. Colonics are probably the best way to do it. I'm not a huge fan of, you know, taking detoxing herbs that can give you diarrhea and cause things. I think it's really nice to use water to simply cleanse the body. And yeah.
I certainly appreciate you coming in today and sharing all this life-changing information.
Thank you for having me.
Do you have some final moments? Not final moments, but we are in the final moments, but some final comments of how we can, you know, really maintain and keep a focus on our well-being, because truly our health is our wealth.
Oh, our health is definitely our wealth. I think just starting to have more awareness about your body. And I like to teach my patients that your body is always talking to you. It's always telling you what's best for it. And sometimes we just tell it to be quiet. We don't listen. We get a headache, we take an Advil. We, you know, get a fever, we take something else. We're always suppressing what the body's trying to tell us. And if you really start to tune in and listen to your body, it'll tell you exactly what you need. You know, you eat something and then an hour later you don't feel good, well, maybe you shouldn't be eating that food, you know? So, and your body will kind of whisper at you, and the longer that you don't listen to it, it'll start to yell, and then it'll start to scream. So I like to tell people, start listening to your body before it's full-blown screaming, because that usually means you're, you know, ending up at the hospital or needing a major intervention.
I totally agree, to listen to our bodies, because our bodies never lie.
They never lie.
And so with this holiday coming up, Dr. Erin Kinney, I am so happy now that you're going to be here in Annapolis.
Yes, yes.
Right around the corner from me, not too far, but anyway, Annapolis.
Yeah.
I love it, and I love you.
Oh, well,
and I want
so
thank
great to have
you. You're
to
absolutely beautiful, and you have such a great spirit about you. So you are a great asset to our community. I know you do workshops.
I do workshops. I'm going to be offering an online workshop from one that I've done in person, and it's called the Ultimate Stress Reset Workshop. So it'll be offered online, I think the first week in December. I can have some more info.
And you're also on Facebook.
I'm on Facebook. You can follow me at Dr. Kinney, and on Instagram at Dr. Kinney. I do videos, and so if you want to go back and watch some of them, I like to teach people a lot of the sciencey stuff behind what's going on in the body.
Well, thank you.
You're welcome.
God bless you.
Yeah, God bless you as
and
well.
Thank you for watching Your Health is Your Wealth. Remember, in this very present moment, we do have the power to take charge of our life and our health. And have an amazing day. And be grateful.